Hi, I'm Dr. Chris Ward with the Dental Implant Center of Oklahoma. One of the things that I would like to address is just talking about maintenance. After we've done and restored someone's mouth, where we've taken all the bad teeth out, dealt with all the pain, dealt with all the infection, and now they've got a situation where they're healthy. Their teeth are beautiful, they're solid, they're able to eat what they want to. This is a point where I'm fully restored in my final teeth. What's next, and how do I maintain these things? And we're going to show you multiple times throughout this treatment sequence how you're going to clean your specific type of situation, because there's different applications for different solutions. So we're going to go over that where you know that completely, and you're going to have all the things that you need, whether it's a water pick, special brushes, whatever those things are. But you're going to be well informed for your home care, what you need to do. Coupled with your home care, you're going to need professional care. We don't provide continued maintenance here at the Dental Implant Center at Oklahoma because we're specially practiced to help you, get from the situation you are till you're restored. But our practice involves surgery and restorations. We don't have a maintenance program. So we have dentists that we partner with so that they can see you in their practice, and they're trained to take the teeth off so that you can clean the implants thoroughly. If there's anything going on, they're going to see that. They're going to, be able to address little gaps that may be happening around the implants where it's periimplantitis or mucositis. And there's things that show up that we want to make sure and address very early if you have problems. That way it doesn't compromise the case long term. So there are dentists that we're going to help partner you with, and your dentist that you currently have can absolutely be that person. Sometimes there's dialogue. I like to talk to them to make sure, they're clear on what we've done. But there's lots of good dentists out there. That being said, the typical sequence or how often you're seen for care depends on the patient. The first year, universally, I'm going to recommend that it's 4 times a year. We know from literature that at about 90 days is when you begin to see bone loss, when there's an issue around the tooth and periodontal disease. We've known this forever. Similar situations when bacteria is around an implant for a certain amount of time, it's going to begin to affect bone level. So that's when it becomes catastrophic. We don't want that to happen. So if we're dealing with that at the point where it might start happening, which is about the 90 days or 4 times a year, the goal is for that never to become a problem where it compromises the actual structures that are supporting these implants. So the first year, 4 times a year, no question. Let's say you're a patient that's real diligent, great home care, do really, really well. And when they take this off, it's pretty clean. There's 4 implants to clean. There's not much going on. And your home care is so good, they may recommend to you, we need to see you 3 times a year or twice a year, just like the average normal patient that comes in for cleanings. That'll be plenty for you because you do such a good job. So it just depends on the patient in terms of how frequent we need to do that. But there are things that at the end of the day, with an investment like this, when you've gone through this process and you've given a second chance to have the teeth and the smile and everything you want to maintain this investment. So, we'll definitely one-on-one with each specific patient, give you specific guidelines and individual information. But hope this information helps all of you. And if you have any questions, please give us a call. Thanks.